we are really just stepping off the porch, if you will, onto the yellow brick road of value-based care, and we see the value of our partnership with ReportingMD in 3 areas. In the area of interoperability, as the slide suggests, we are currently aggregating data from 2 different systems. We use Cerner on the hospital side for claims data only via an 837 file, and from Athena on the clinical side via an API, which provides both discrete clinical data as well as claims data. Incidentally, we have 2 more EHR systems among our practices that we are considering for the roadmap, but right now we're just relying on claims data from those systems. Because of the way we are connected, I therefore don't have to use time or human resources to manually extract flat files and make sure that they get transmitted. And amazingly, ReportingMD has the patient match game nailed. I have worked with projects and vendors involving data exchange and data amalgamation, where inevitably I had to allocate resources just to address duplicate patient records while vetting the data. And I don't have to do that with ReportingMD's results, thankfully. Additionally, the result is a full patient story at a glance. So I can look into the reporting tool and see all of the quality measures, including, and very importantly, ones that Athena, which is our primary EHR, does not have built out in their quality configuration. So it gives us more flexibility as far as the measures that we can choose to monitor, and it gives us that snapshot of the patient. Plus, I can also see their RAF score at a glance alongside those quality metrics. So, and further, with the data that we're providing securely, ReportingMD is able to create our own mini clinical data warehouse that allows visibility to the big picture of my patient population across all of the systems. The second area that we value is the service area. And here I have a disclosure that I probably should have just led with. When Molly and the team first asked me to participate in today's webinar, I was actually a little surprised because I feel like I am one of the most, if not the most difficult client they have. I ask a lot of questions, a lot. I'm a detail freak and process improvement junkie, and I want things to be right, and I want them to be right quickly. And sometimes my questions are about, CMS's gobbledygook, and sometimes they're about my own data. Sometimes they're about, focus and what should we be working on. Sometimes they're about accuracy. Is this right? Is this really what I'm seeing? And most of them I ask about an hour before I need the answer in order to finish a report. But in every case, every single one, they answer my question with patience and thoroughness, and at a level that I don't see with a lot of healthcare vendors. So I'm grateful for that. That said, one of the greatest value adds that I can point to is the overall MIPS scoring optimization provided as a result of the research that Molly does. I know that all of the teams are very tuned into what's going on with CMS, but the total outcomes management tool and the monthly sessions that we have with our dedicated advisor, which give us that visibility to that composite score. And I am 100% sure that if I were left to my own devices, I might be able to keep our eligible clinicians out of the penalty area, but I would not be able to get our scores into the exceptional performance range as we have been since we started using ReportingMD in the 2018 reporting year. With regard to program transition opportunities, in 2021, we added value-based incentive amendments to just a few of our payer contracts and asked the ReportingMD team if we could expand the list of measures we are monitoring so we could apply the same positive outcomes to that world of work. And of course, the answer was yes, and I fully anticipate we'll see a return on that investment. Regarding value and results, I attribute our consistent progression from a composite score in the 80s to 2 consecutive years in the high 90s, including the navigation of the extreme and uncontrollable circumstances rules, to the guidance and expertise of Molly and her team. And just overall, ReportingMD staff constantly working on thinking about value-based care in a way that not only works to get better care for the patients in my organization and for the providers on the ground giving that care, but to figure out how to return as much of the revenue created by that work back to the organization as we continue on our path to that magical city at the end of the yellow brick road, whatever that is, and however many times it's going to change between now and the future. So those are, kind of the 3 ways that we're taking all of that, or 3 areas that we're taking all of this good stuff and applying it here. I am happy to answer questions about, either in this setting or even offline, if anybody has questions about our model and how we're using these services here at Gerald Champion.
Jen, I couldn't have said that better. Absolutely, you're a cherished customer, as you all customers are. But we love the questions, and so with that, I think it's a great transition to